Thank you, everyone. So this is the last session for today. I'm very happy to be moderating it. But to begin with, I would like to invite Mr. Ali Raza Bhutta Sahab for a framing presentation. By way of introduction, Ali Raza Bhutta Sahab is a member of the Pakistan Administrative Service. He's currently working as an advisor with UNDP in their National Governance Program. He has worked on a number of senior positions with the federal and provincial governments, including as secretary in ministries dealing with public finance, social protection, human rights, and energy. So over to you, sir, for a framing presentation on financing social protection.
So, ladies and gentlemen, when one is working in one's bureaucratic silos and is asked to reach out and collaborate with people working in other silos, sometimes it is worthwhile to go back to the basics. So I will start with going back to the basics initially, and then give some current imperatives of why that is necessary. And finally, we'll leave you with some suggestions and questions about the institutional framework and how collaborative sustainable financing can be done. Thank you. Isse aage jayega? Piche? Okay. So, going back to the basics, the Constitution of Pakistan, this is Article 32, clauses C and D, which are flashed here. The social protection in Pakistan is a responsibility of the state. These are not, this is not a fundamental right, but it's a principle of policy. And it states that the state shall provide for all persons employed in the service of Pakistan or otherwise social security by compulsory social insurance or other means. The state shall also provide basic necessities of life such as food, clothing, housing, education, and medical relief for all such citizens, irrespective of sex, caste, creed, or race, as are permanently or temporarily unable to earn their livelihood on account of infirmity, sickness, or unemployment. And what is state? According to Article 7 of the Constitution, in this part, which is the part containing the fundamental rights and the principles of policy, unless the context otherwise requires, the state means the federal government, the parliament, a provincial government, a provincial assembly, and such local or other authorities in Pakistan as are by law empowered to impose any tax or cess. So anybody who has access to public money through taxes or cesses is obliged, any level of government, to provide the social protection that we have seen above. Now, coming to the imperatives today. This is para 6D of the Memorandum of Economic and Fiscal Policies that we have signed with the International Monetary Fund only last September. The National Fiscal Pact to rebalance intergovernmental relationships. The federal government and the provinces have agreed to sign a National Fiscal Pact by end September 2024. It has been signed, and I'll be coming to that, whereby some spending responsibilities from the federal government will be devolved to the provincial governments in line with the spending allocations established in the 18th Constitutional Amendment, including additional contributions for higher education, health, social protection, and regional public infrastructure investment. At the same time, the provinces will take steps to increase own tax collection efforts, etc. Now, that National Fiscal Pact that has been mentioned there has been signed. This is what has been reported as one of the clauses in the press. The federal government, in consultation with the provincial governments, will examine social protection programs rolled out and planned by the provincial governments and BISP, respectively, to identify overlapping programs and fiscal allocations and take fiscally prudent measures accordingly in ways which strengthen and improve generosity and coverage of social protection. So this is what the provincial governments and the federal government have already agreed to, reportedly. So this gives rise to a number of questions. How soon can this responsibility be handed over to the, can go to the provinces? How soon can the provinces take additional fiscal burden? And how much can they take? Is there an appropriate forum for consultation and decision making? Is CCI an appropriate forum for that? Is National Economic Council an appropriate forum for that? Do the provinces have fiscal space, or would the federal government have to transfer some additional resources? I mean, these are questions that would need to be discussed between the federal government and the provincial governments. And then there are the political imperatives of the federation. We have four four provincial governments, two of them belonging to one political party, two others to two other political parties. So how can one come to an agreed framework? There were two slides that I would like to show. Nahin, it's piche. I want to go back. I can? No, I can't. Very quickly, I'll just take 1 or 2 more minutes. So just a few questions that I would like to pose to the panel. Ji, aage, 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 aage. Yes. So, which I've already asked these questions, but I have some suggestions too. Planning division has an overarching planning role, and it is also the Secretariat of the National Economic Council. Can the planning division perform that role, and with the provincial planning departments in that position? CCI, NEC, I've already talked about. Is there the need to create a new forum, or is BISP structured in such a way that the provinces can collaborate with that? BISP board, at least till I was in the Ministry of Poverty Alleviation, did not have representation from the provinces. So if that structure is changed, can that become a forum where such discussions can take place? Are there mechanisms available where institutions like BISP and NDMA can collaborate and have joint decision making, both different autonomous entities with different boards of governors? Is it feasible for the provincial social protection authorities and PDMAs to collaborate with PAS or BISP or NDMA for their planning and operations? And finally, the final slide. Agli pe aaiye, please. But we have had some discussion. Mr. Abbasi from the World Bank this morning suggested that probably the provinces can take up more fiscal burden on the conditional cash transfer programs. That is one legitimate way of distributing the functions. But then, as the provinces already have a big role in the social protection for labor and farmers. So one can probably have sector-wise allocation. Then there can be programmatic distribution, zakat, pensions, insurance, income support. So provinces and the federation can discuss that. I've already talked about conditional programs. And then probably there will be need to discuss how they can jointly and collaboratively finance and design new programs. And of course, the joint ownership of the targeting mechanism, the NSER, and I've mentioned the governance of NSER, which is only federally controlled at the moment. If provinces can be made part of that governance, and the joint and collaborative use of the delivery mechanisms that BISP has established. These are a few questions that a discussion on collaborative and sustainable financing and planning would need to answer. So thank you very much.
Thank you, Mr. Ali Raza Bhutta, as always, for very thought-provoking thoughts and also for raising those questions, which I hope we will get to once we're in the middle of our panel discussions. I'm particularly keen to unpack a little bit more what I understand as diagonal coordination. So with the last question that was raised, so when we're talking about, the potential opportunities for collaboration or coordination between PDMAs and BISP, let's see if we can explore that a little bit more. And in case I forget that, I will, on account of insufficient caffeine in my system, I will ask my colleague Faiz to just remind me at some point that I'm missing a question. So without any further ado, I would like to invite our esteemed panelists for the day. I will start with Dr. Mohammad Nadeem Memon, who's with us, who is a distinguished civil servant with a career spanning over 27 years. He's worked on transforming Pakistan's public sector through roles in customs, policy development, and diplomatic missions in Mexico and Brazil. He's currently serving as Joint Secretary of the Finance Division, and he has been a driving force behind crucial initiatives like the National Survey for Tax-Based Broadening and the National Program for Family Planning and Primary Health Care. His commitment extends beyond his official duties, as he has actively managed charitable blood and drug banks, showing how public service can create meaningful change in communities. Next, I'm also pleased to introduce Mr. Mohammad Tawfiq, who currently serves as Additional Secretary of Planning Development in Khyber Pakhtunkhwa. Throughout his impressive career, he has held pivotal positions, including Chief Staff Officer to the Chief Secretary and Confidential Officer to the Chief Minister of Khyber Pakhtunkhwa. He has been instrumental in shaping policy across various crucial departments, from education to finance, bringing valuable insights from his experience in public sector management and administration. Welcome, sir. Next with us today, we have Mr. Noorul Haq Baloch, who serves as the chairperson of the Balochistan Revenue Authority and is the focal person to the Chief Minister of Balochistan on social protection. He has been instrumental in shaping health and social welfare reforms in Balochistan, notably as a key architect of the Balochistan Health Card program, which has extended health insurance to over 2.3 million families. His work has also included establishing the Balochistan Awami Endowment Fund, providing critical financial assistance for medical treatment to thousands of underprivileged patients. Thank you. Also joining us today is Mr. Ali Shehzad, who is the CEO of Punjab Social Protection Authority and is the project director of the Punjab Human Capital Investment Project. With over 15 years of experience in public service, Mr. Shehzad has been instrumental in driving innovative social protection initiatives in Punjab, including the Punjab Socioeconomic Registry. His leadership is helping modernize service delivery systems, making a significant impact on the province's social protection landscape. And our final panelist for today is Mr. Irshad Ahmed Qureshi, who currently leads both the Energy and Water Resources and the Social Welfare and Zakat departments in Azad Jammu and Kashmir. He brings around 28 years of experience in transforming public service delivery and governance systems. Mr. Qureshi has been particularly passionate about social protection initiatives, having pioneered programs that support vulnerable populations while also championing reforms in education and legal frameworks. So I'll move on to my spot on the panel and we'll carry on over there. Great. So I have a couple of things on my mind, both from Mr. Ali Raza Bhutta's presentation and then in general as well. And so we'll frame our discussion around those. And then the way we'll proceed is I have a few questions and I'll ask your responses. And then we'll open up the floor for audience questions and I'll just manage things when we get there. So I'm thinking about different planetary crises, right, of which we are also experiencing at the moment. So climate change, biodiversity loss, and pollution, to name a few. So over the years, given how things are evolving and how these crises are evolving, vulnerabilities are not going to shrink anytime soon. Instead, they're going to expand, or our ideas of vulnerabilities are going to expand, which means that we're going to have to make not only programmatic but also fiscal space and fiscal, let's say, innovations to cater to those vulnerable populations through social protection. So just to name a few, the groups when we talk about vulnerability, and I want to make sure that we're also considering inclusive social protection when we talk about programming or when we talk about financing. So just to name a few, women, children, the elderly, people with disabilities, communities that are otherwise socially, politically, or culturally excluded, workers in the informal economy, and climate vulnerable people, to name a few, are the worst off, and we know that from the case of Pakistan as well. So I'll start off with you, Dr. Nadeem Saab. So with your unique perspective, could you share how the finance division is ensuring or can ensure predictable and sustainable financing for social protection, and if there are any innovative approaches that have been adopted or are underway at the moment?
Thank you, Main, for inviting to this August forum for discussing this very vital issue, which is presently our country is tackling quite effectively and doing a lot of work. A lot of work has been done in this regard with the federal government, provincial governments, and our partners in this regard. When it comes to federal government, the federal government has to face a lot of challenges in the form of low tax to GDP ratio, in the form of economic emergencies, in the form of the natural calamities, the earthquakes, disasters. So being the central government, it really has to already face a lot of things to cater for the population of 241 million of the country, growing at a population rate of 2.55. In this backdrop, it is really very hard to match up the balance and to have a comprehensive strategy to balance between the available scarce resources and the growing needs of the population. Especially after the 18th Amendment passed in 2010, the basic subjects which we are referring to here, like the poverty, health, education, and infrastructure development at the local level, these have been devolved to the provinces. So when the constitutionally arrangement has been made in a way that these systems have been devolved to the provinces, but at the same time those are to be tackled by the federal government. So this needs something different, and this cannot be tackled by the federal government alone. So it has to have a multi-pronged strategy where the federal government as well as the provinces should come together and develop a mechanism in such a way that this problem is solved. When it comes to the federal government has been providing and will continue to provide a kind of macroeconomic stability, financial stability with an overarching principles of providing certainty and stability for the provinces so that they can work with these devolved powers satisfactorily and effectively. When it comes for the provinces need to, first of all, have to take up the ownership of that. Because once they are getting the financial resources, which I will further elaborate in a while, at the same time they should also come forward to take up the ownership of these projects. In terms of federal government, together with providing the budget certainty, providing annually the funds, federal government can need to consider about the medium-term budgetary financing so that on the basis of the needs, the financing can be done as and where is required. Diversification, because there is the time has come that we need to develop our own capacity at the level of the federal government also to diversify our resources. it will not be in our own interest to continue for a very prolonged period of time over our partners who have always been with us in all the times of difficulties and supported us. So we need to diversify our source of financial resources. Public-private partnership is also another good area where the federal government can evolve by giving some incentives to the private sector to come forward and take the joint responsibility. Social sector protection levy can be an idea which can be implemented to raise the funds level at the financial level. The disaster link framework is also important where for some kind of disasters, a kind of contingency pay fund need to be kept in mind and kept in place, which can be utilized at the time of the disasters, so that not only those people who are already in the social protection program, those who are not into the social protection program, if they are affected by disasters, their needs can be looked after. Now, coming to the provinces. What the federal government requires from the provinces that after the post-NFC, post-18th Amendment scenario, the National Finance Commission award, which used to be around 1 trillion in the year 2010, now it is around 4.5 trillion. So see how much amount of the funding has evolved to the provinces from the federal government. Again, the resources generated by the provinces, both tax and non-tax revenues, in 2005, it was around 71 billion. But now it has crossed around both tax and non-tax revenues. It has crossed around more than 1 trillion. So provinces have their resources now. I'm not saying that they have the adequate resources. They still need a lot of resources to meet the growing challenges. But with these resources, they need to increase their own tax revenues so that they have more funds. Their approach should be proactive rather than reactive and depending upon the federation. There has to be a data collaboration and sharing of information between the federal government and the provincial governments so that the resources are not wasted. There should not be the duplication of the resources and duplication of the efforts. So these resources are to be jointly shared. Data should be jointly shared. And the provinces need to develop their own capacities. Federal government will assist them. And in this way, I think it's a combined effort in this post-18th Amendment scenario, which can enable us to meet these growing challenges. The National Fiscal Pact, which our learned Bhuttasab was referring, has been signed in September. So, and that also take into account the devolution of these major expenditures to the provinces. So once that pact is operationalized, that will go a long way in devolution of these resources, and I hope that will be a good way to move forward. Thank you very much.
Thank you so much. So I hear a lot of how proactive planning and then as well as more streamlined coordination and collaboration can help enable a more efficient social protection system. And thank you for raising those ideas, especially the one about data sharing and how data sharing can incentivize, let's say, horizontal expansions if we're talking in the event of crises, and then just in general avoid duplications. So moving on to you, Mr. Tawfiq Sab. So can you share your insights on how interprovincial and federal collaboration can help ensure that financing for social protection is responsive to the needs of communities who are displaced or otherwise vulnerable?
Thank you, Mahin. Collective learning has always yielded very good results. So taking the best practices in view and the lesson learned from the others while framing policies and while conducting initiatives is always helpful, and that definitely it should be. Now, what should be the collaboration and what should be the engagement between the provinces and the federation? This is not a simple question as it looks like. Being a student of the Constitution and especially after the 18th Amendment, many subjects, including this social protection, stands devolved to the provinces. And in this scenario, it becomes a bit tricky to work in this behalf. So there are some examples that we can use, and the path that we can also use in this perspective. I want to quote an example of education sector, that education is purely a devolved subject, but some few things are retained by the federal government in the shape of IPMC. This is a council of ministers, and that oversees the things. This sort of arrangement can work in this social protection side also, wherein provinces and the federation can come forward and they have collaborated efforts. I want to add something more about the initiatives, the successful of initiatives or the sustainability of the initiatives that usually we take. In country like us, many times our initiative are very good in the start, but they are not sustainable and they get fail while they are in the operation phase. So I had, in our P&D, we had a diagnostic exercise a month back, that why this happens to our initiatives. And so especially when it comes to the social protection initiatives, this can't be this is not affordable for a nation, where there are resources are less and the problems are more. So we came to this diagnostic conclusion that once we initiate initiatives, these are not well thought out. So in P&D department in KP, we have linked all the projects with the concept note. So every initiative, which is irrespective of its size or the volume, we shall first have concept note of the initiatives, scrutinize it, and then we shall get it into the PDWP, that is the statutory forum for approving such initiatives, and if it fits to everything, then it will be approved, and then it shall be included in the annual development plan. So this would minimize the effects of getting the initiative failed. So this would. And one thing more I would like to add to the information of the audience, that we, for flood resilient or climate change, climate resilient infrastructure, we have also already added our PDMA, or the relief department, in our project approving forums. So this would go a long way in our planning and development. Because once you are erecting a project, and if it involves some brick and mortar like hospital, school, or whatever like that, and if floods comes and washes it away, so it brings your social protection very down to the level. So these are the things that KP government is taking place. Moreover, we are injecting a lot of money into the social protection, irrespective that we don't have at this point of time, we don't have a social protection authority, but this doesn't mean that government of KP is not cognizant of the situation. We, in a month back, we started an initiative of rupees 4 billion Ehsaas Rozgar, a loan program that would not only take care of the vulnerable part of the society, but also graduate them, because just helping the people to meet their lives is not the thing. The thing is that you put money into it and make them graduated from their status. So KP government is providing 4 billion rupees for this scheme. Another scheme wherein we are providing 1.5 million loan without markup to develop people their own homes and serve as on the pattern of B&B. So this would help many people to earn their livelihood. Again, we are injecting almost 13 to 14 billion rupees in textbooks, and we are providing stipends. All these things are by which we are catering the unprivileged society of the Khyber Pakhtunkhwa. And very soon we shall be erecting our own social protection authority. And it would be my request for the forum that we want to host next this session in the Peshawar. If authorities and the people are willing, we shall be welcoming you. Thank you.
Thank you so much, sir. And we're taking note of the invitation to host the next conference in Peshawar. But what I also find interesting and a takeaway for me is how far well-informed decision-making can go, and there are steps that KP is taking towards that direction, right? So with concept notes, including, I hope, the plans for sustainability of programs as well, I think there is a lot of inputs that can then help drive informed decision-making and then also informed planning. So that's very good to hear. Next up, Mr. Nurul Haq Baloch Sahab. So Balochistan faces unique challenges when it comes to financing social protection due to the way that the population is structured and also the geography. So in your experience, what financing solutions have worked or are being explored at the moment to ensure that these challenges are met and that last mile coverage is ensured?
Thank you, Maheen. Thank you for inviting me to this very important conference because... On it? We? Okay. Yeah, actually Balochistan has, again, its unique challenges. And as we saw that the state is responsible for the social protection. The state includes the federal government, the provincial government, and the authorities. So for the legacy of the 70 years, because if we see the data of today, 71% of the population in Balochistan is below the poverty line. The majority of the poor live in Balochistan, even more than in the sub-Saharan countries. And just 71%, but if we go for the data, for example, 2.3 million families are registered with Nadra in Balochistan, but as per our estimate, there are 3.5 million families. Just to make it very simple for the understanding of the people, there are 2.5 million government employees, which we can say that they have a earning source. 5 million who are in entrepreneurship and small businesses and agriculture and rest. So rest of the about 20 million, 25 million of the people in Baloch families live under the poverty. Again, if you see the data of the literacy, 42% and 32% literacy only for the female. Highest unemployment rate in Pakistan, 9.3%. And out-of-pocket expenditures that on the healthcare, because it has been neglected, but it is the most critical factor which shifts a good earning family from the earning family to a very low income. It is more than about 70% of that. So these are the major challenges. And if we go for the out-of-school children, for example, there are 3.13 million out-of-school children, 5 to 16 years of age. So meaning that these will be adding to your poverty line, because the vicious cycle of poverty shows that if you are not educated, then your kids will not be educated. So this is not a number just. I'm not quoting the percentage and everything. 3.31 million families in the next 10 to 15 years or 20 years, they will be adding to the poor of the Balochistan. So these are the biggest huge challenges. Now coming to the finances of the Balochistan, yes, because the revenue source of Balochistan, although it is rich in minerals and everything, Balochistan, as we say that on daily basis, and we read it and we share it, but still Balochistan is completely dependent on the Federation for the revenues. Except for 36 billion rupees from its own taxes, 50 billion rupees for its own resources, but rest of the funds coming from the under the NFC. Yes, it is true that the funds are coming to under the NFC, but keeping in view the gigantic challenges, as I mentioned, that we have to bring our these 2 million families, more than 2 million families from the poverty line to earning income. You can imagine that the monthly earning income in Balochistan is just 18,000 if we go for that. And so the healthcare, the education and all these facilities. So it will not be possible for the government of Balochistan at this stage to take over the whole social protection programs or initiatives to finance from its own resources. But yet, just to showcase that what we did in the recent past, two major programs were. For example, one was the health card program. 2.3 million families of Balochistan are covered under the health program. All of the Balochistan is covered today under the health program, and they have a insurance coverage of more than 1 million rupees. And 1,200 hospitals all over Pakistan are opened for the poor patients of Balochistan who have a small secondary or up to a limited tertiary care health need facilities. Another, this is costing 5.3 billion rupees to the government of Balochistan per annum. Secondly, a very major initiative which we took as the social protection, it was back in 2019, because at that time I was the Secretary of Social Welfare and Government of Balochistan. In the Government of Balochistan, we invested 3.2 billion rupees as an endowment program, because in Balochistan we don't have a cancer hospital or liver transplant hospital or hospitals which the healthcare facilities which can cater for the highest catastrophic diseases, which were the 7. And we opened 17 of the best hospitals in Pakistan under this program. And now every Balochistani is entitled, definitely the poorer are poorer. More than 4,000 patients have received under a grant under this program, and 4 billion rupees has been spent. And the model, the model we did, 3.3 billion rupees were initially invested, and now it stands to 8 billion rupees. Today the fund is 8 billion, and from the proceeds of this fund, we are catering for the poor patients, because we know that the out-of-pocket expenditures are the huge expenditures. So these biggest program. Another program which we are going to launch, because unless you have an educated society, unless you have educated mothers especially, for example, in Balochistan today, 100,000 kids are enrolled in the government public sector schools. We are planning that for a stipend, which will be a conditional grant, and we will be transferring to make sure that transition is from the primary to the middle and middle to the high is ensured. Because unless we have an educated society, we can't remove this, we can't break this vicious cycle of poverty. So these are the biggest challenges, the unemployment. Because in Balochistan, the major employment source is for the government of Balochistan. Just to imagine, the last year, 145,000 youth appeared in the matriculation exam. And what the source of income, what the source of industrialization or job opportunities we have? Just the government of Balochistan, which can provide 2,000 to 3,000 to these matriculation students. We can say that 50,000 go for the agriculture and the entrepreneurship. But where will these 100,000 kids who appeared in the matriculation exam? I am not talking about the out-of-school children. I am talking about the 150,000 kids who appear annually in the matriculation exam. So we can cater for the 50,000 to 60,000 informal and formal jobs, because no industrialization, government is only the source for the employment, agriculture is rudimentary, and the water is more than 1,200 deep, and so you have to ensure that how can you bring water for agriculture, border areas, small businesses. So 50,000 can be accommodated in the formal and non-formal businesses. But what about the rest of the 100,000? This is the crude data. This is not I am not talking about the data that we have to cater. So 3.13 million kids, 5 to 16 out of schools, 71% out-of-pocket expenditures on health, unemployment rate, the highest, income levels, the lowest. These are the challenges. I think the federal government and the provincial government and the donors and all the partners have to jointly collaborate for a better social protection program in Balochistan. Thank you.
Thank you so much, sir. And I think that offers a lot of perspective to all of us when we think about the lives that are involved over there. So I'm just still thinking about the 3.1 million out-of-school children you mentioned, right? Because evidence or research also shows that these children are then at higher risk of being involved in child labor. And then when you talk about children being involved in child labor, they're also at higher risk of having their rights to protection be violated, so on and so forth. And then that just sets up the rest of their life course trajectory in a negative sense. And then we have all the other challenges that you've mentioned as well. And I'm just also wondering, out of those 3.1 million children who are out of school, I wonder how many have their birth registration completed or how many have their birth certification in place, because I'm also wondering about who we count and how, and if we count them from the beginning, then we're able to track them throughout their life course. And that brings me to Punjab as well, because I was very pleased to see recently in one of my meetings with Punjab Social Protection Authority that with the Aghosh program, there is some form of incentivization going on to encourage families to register their children, which is, I think, a very positive step, and that too in the right direction. So coming to you, Mr. Ali Shehzad, my question to you is, Punjab has evidently made substantial investments in social protection, and it continues to do so. But regardless, what is one gap that still persists, in your opinion, and needs to be addressed, and how can financial planning and execution help address it to effectively close the gap and ensure more comprehensive coverage?
Thank you, Maheen. It's a pleasure to be here and a part of this esteemed panel. Yes, the government of Punjab has been investing heavily in the social protection domain. There was a very heavy investment at the start of the inception of the authority back in 2015, and which was sustained for quite some time, for a few years. Then there was a slight dip in the financing side, but now the government of Punjab is very serious and once again investing heavily in the establishment of the Punjab Socio-Economic Registry, which is sort of the baseline and a mother of all databases in that sense, to actually make sure that all the social protection spending that is being made is better oriented, better targeted, better delivered and all. So far as the gap is concerned, I think you said what's the one gap. I don't think, I mean, there is a list of gaps that I have in mind, but if I were to say and which I will mention as well, but if I had to mention just one gap, I think the gap is not just in Punjab, it is everywhere when we are dealing with social protection domain, which is sort of, I would say, an ad hocism in the allocation of expenditures and the design of the programs. Because like I've mentioned earlier, that social protection is a very cross-cutting domain. And if you look at literally anything in the public domain, you can define it from the perspective of social protection. And if even Watson sector, you know, if you are investing in Watson, you are indirectly investing in health, and by way of that, you're investing in education, because if the children are healthy, then they will go to school. And if you want to define social protection, if you want to define anything from looking at the lens of social protection, you can do so. One gap that remains, I think we stick to thinking about social protection in terms of conditional or unconditional cash transfers. However, social protection should and ideally go much beyond that. And not just, since we are talking about collaboration and financing and planning, so like when the SDG domain came in, we were trained to look at everything from an SDG perspective. And then we started defining our development thinking, structuring it in form of, you know, what SDG is this ticking, and, you know, is this agenda which we're trying to do, is this missing out on any SDG? So I think one thing that is missing conceptually is to look at the social protection, the one thing that is missing is to look at our entire financing, our development financing and development expenditures, and look at it and plan it from a social protection lens, so that there are synergies, so that the health and education and cash transfers and everything else that we do under the asset transfers, the graduation schemes, all things, they all roads should lead to Rome, and which is to have a consolidated and integrated framework for actually delivering. And I would like to mention here that I had a chance to visit Brazil last year with the World Bank team, and the representative of the MOPAS and all provincial governments were there. And what we looked at in Brazil, the Bolsa Familia and all, they have adapted, they have adopted social protection as a pathway to development. Here we are mostly thinking it as, and one of our colleagues, I think from KPE, said that as well, that it should not just be for making them, giving them sustenance or helping them survive. It should also be helping them graduate, grow, thrive. And that is, I think, that is something that we need to look at when we are doing the development planning and the financing. So that's one, if you say one. But there are other gaps as well, and which, I mean, we have talked about the NSCR and the NSCR being housed in the federation, and Mr. Ali Raza Bhutta also mentioned that he left this as a question about the joint ownership of the NSCR, and that is very much a possibility as well. But right now, my experience, as we have, the government of Punjab has crossed about 7 million families being registered in the PSCR as of today. And of those 7 million, we have about a gap of 16%, which were not present in BIS, in the NSCR. So this 16% gap is of the people who actually came, who were existing in Punjab and who have come to our desks. And there may be people who have not come to our desks, and they may also be, unregistered in the NSCR. So while NSCR was great and is there, and it is obviously, it has the comparative advantage of of an early start and an advantage of 15 years, but still, I mean, not that PSCR would be perfect. No, a project of this scale cannot be 100% perfect, but if there are gaps, those gaps need to be plugged, and that is another area that the government of Punjab is working, which is improving coverage, going beyond NSCR and making sure that all the families are there and are visible and are observable, and when we plan our social protection initiatives, they are also included and not left out. And the third thing I would, and the last thing that I would mention here is in the context of once again, the fiscal devolution of the fiscal, rather the devolution of the fiscal burden of the social protection to the provinces. I think it's not just about fiscal devolution, it's also about operational readiness. The operational readiness of the provinces is as much a prerequisite for this entire thing which the IMF or the National Fiscal Pact is pushing us to do, as is the fiscal readiness which the provinces are ready to take the burden or not. I mean, just eyeballing the numbers, we have the BISP's budget is around 600 billion per annum. And if the Punjab is going to bear half of it, let's say, half of it by its share of population. So 300 billion rupees is being spent by the federal government in Punjab every year. And if you ask the government of Punjab to bear even 1/5 of it, like 50, 60, or 1/3, $100 billion, it's 100 billion rupees. It's not a small chunk. It would take away a big chunk of the fiscal space that the provinces. And this is Punjab, which I'm talking about, which may have the finances available, but it may want to divert it to other sectors. And like our colleague, respected colleague from Balochistan has mentioned, that there are other federating units which don't have the capacity to bear that burden at all. So all that said, that fiscal readiness is one part and the operational readiness is the second part, and both of them, I think, not in terms of capacity, but in terms of the willingness, remain a challenge, because obviously the governments would want that unless more finances are transferred to us, they might not be entirely willing to share that burden. That's where I'll stop. Thank you very much.
Thank you. So I think that was also very insightful. And we're talking about all roads leading to Rome, but I also hear it's important how you build those roads and how those roads are essentially constructed. That is equally important. And I'm also very glad that you mentioned that we need to think about social protection beyond just conditional or unconditional cash transfers, because that also offers a completely unplanned segue into my next question for Mr. Irshad Ahmed Qureshi. So, having worked on social services in Azad Jammu and Kashmir with regards to child protection and in developing that side in the last few years, I'm very keen to hear more about your experience with financing social service programs, and that includes social service workforce strengthening and the child protection program over there. What has the experience been, and to what extent does this come up as a priority in your experience of having worked in that domain?
Thank you very much for having me here and providing this opportunity to share few highlights of AJK Social Protection Program. First of all, I would like to say that AJK Social Protection Program is unique in a sense that it is not a donor-driven program, and it speaks about the widows, the orphans, the transgenders, the disabled person and elderly population. AJK does not have a formal economy, so the government is the largest employer, providing over 100,000 job opportunities to the public at large. So keeping in view the limited space in our budgetary allocation, initially we conceived a program by which we planned that all the person getting salary from the government exchequer, they will provide 1% of their basic pay to a fund which will be utilized for the welfare of vulnerable population. So the idea was appreciated by the government and the cabinet and the civil society, but later on we witnessed that some of the contributors, like civil servants, they were reluctant to extend this support. So then the government came forward and provided and allocated a handsome amount of 10 billion rupees, which were invested in government investment saving policies in order to generate more funds and more resources to make the program sustainable. So this year we have a substantial amount to disburse to the eligible vulnerable population, but keeping in view the reduction in the interest rate, the sustainability of the program is a real challenge for us. But at the same time, the government and the social protection and the social welfare department, they are cognizant of this fact that we would need more resources and we need to make the program sustainable. For that purpose, we have made some plans. First of all, the government has expressed its resolve that by all means they will provide additional budget if required to make the payment system sustainable and smooth. And secondly, we would also request our contributors to voluntarily contribute towards the fund. I mean, few departments and organizations and their associations they are willing to contribute toward the funds. So hopefully we will get resources from from those contributors as well. And thirdly, we have over 2 billion Kashmiri diaspora, and they have shown interest in this program, provided if we could make it robust and transparent, and hopefully they will chip in this initiative. And lastly, we would also request the international partners, the development organization, to look our program and to come forward to support us in whatever form they would be able. And lastly, I would I take this opportunity to request that AJK may be given the representation in inter-ministerial provincial social welfare forums, so that we could benefit the experience of other provinces and the governments. Thank you very much.
Thank you so much, sir. And this is also duly noted. I think it's time to move on to audience questions. So I opted against Mentimeter. And just to flag, I have terrible eyesight. So I will require some help in identifying people who have raised their hands for a question. I'll take up to 2 questions to start with. So if you have a question, I will request please raise your hand or just make yourself known. Be creative if you want to be. If you have a question for a specific panel member, please also mention that. Otherwise, we'll just ask any member to volunteer and respond.
And we have up to 12, 15-minute max to...
Okay. So if you have a question, a pressing question, I see.
Yeah, thank you. So my question is for actually everyone, maybe the provincial social protection authority people can respond. So, we often talk about duplication between federal, provincial, and then even within province there is, duplication of programs. But I think we should also talk about the gaps that probably we are having in different program implementation. Like, if Punjab is implementing a program on health and nutrition, Sindh is implementing a program on health and nutrition, and then federal government is also implementing a program on health and nutrition. So we do discuss the duplication of resources, duplication of program. But I think we also discuss the gaps that if we can try to fill to make a comprehensive approach in terms of addressing, let's say, the objective of both programs being run at federal and provincial level, objective is to address stunting. So we can see what other elements of stunting are missing, which we can, like federal government and provincial government can join hands to address it. Like we are providing specialized nutritious food, we are covering immunization part, Punjab is covering the institutional delivery, immunization and other things. But there are other components like water and sanitation, there are behavior change communication related component missing. So I think we should also, with duplication, we should also discuss the gaps through which we can, by filling those gaps, we can improve overall status of human capital development. So maybe any thoughts on how we can collaborate in a way that we can fill those gaps and achieve maximum outcome out of the implementation.
Thank you, sir. So if anyone wants to start off, so the idea being how can we better collaborate on achieving common objectives, right? So across provinces, we might have different programs serving a similar objective, but how can we potentially expand the horizon of said program to potentially then have a multi-pronged approach to the same end? Who wants to?
Thank you, Naveed. I think that's a fair point that when we talk about the duplications, we should also be minding the gaps. But at the same time, I think the very fact that different provincial governments or the federating units can actually design their own programs also lends a lot of flexibility in prioritization. yes, there is very much a set principle of activities which, which are considered to be the, pet recipes for investing in human capital development and fostering that social capital that then, human capital that then translates into and yields dividends into health, education, employability, and onwards. But the fact remains that the different provincial governments can be told about what is the potential portfolio of options from which they can choose a certain set of interventions. But at the same time, one provincial government may think that health and nutrition is, an important priority for us, important enough for us to invest in it, and then another government might think, something else is a higher priority. So the gap would remain, but the gap should not be unintentional, I would say. It should be intentional, if at all, because then the governments have considered it as an option and ruled against it. In that case, the gap would be an intentional gap because of divergence of priorities and not necessarily a gap of omission. And that is what sort of, gives this whole paradigm of decentralization its charm. It lends its charm that different governments can, choose different set of interventions within the, two health programs, both the governments may be running a health related program, but the ingredients may be different.
Thank you. Do we have a response from any other panelists on this question? Yes.
I would like to add to the answer made by my colleague. Frankly, if we go by the book, then there will be no duplication. For example, if health, there is a program to be conducted, the initiative to be taken in the health sector, purely it is a devolved subject. Province has to take initiative to its territorial jurisdiction, and as it comes to the federation, it shall be restricted to the federal territory only, as per my understanding of the constitution.
Thank you. One more question. Oh, all right. So let's go with that one, and then we'll go to this gentleman.
So these are the two last questions. So keep it short and simple. And if you have a specific person you want to have the answer, ladies first. Ladies first. But we collected two questions, right? Oops. Sorry, difficult.
Thank you. I'm Aisha, and my question is, how much of input from the districts on kind of what sort of social protection they need, or I really like the comment of using social protection towards the development journey. So how much of inputs are we getting from the districts, and plus how does district spending done by the provinces correlate with the human development indicators and that overall picture?
Let's collect the second one.
Hi, good afternoon. One quick comment and two very brief questions. Thank you, Bhutta Sahab, for a very nice framing presentation talking about sustainable financing. I would slightly differ. Sustainable financing, sir, with due respect, if you allow me. Talking about National Fiscal Pact makes sense, really good, but when we talk about sustainable financing, that's a completely different ballgame. We mainly refer to ESG standards, which we don't have yet. So environmental, social, and governance standards, the reporting is absent. We have a long way to go back. So when we refer to sustainable finance, that's, with due respect, a totally different thing. Two very quick questions, one for Mehman Saab from Finance Division. Sir, referring to public-private partnerships, you gave us a few options: contingent financing, levies, budgetary allocation. Perhaps I missed it. If you could clarify, I'm not able to grasp the role of private sector in these options. Maybe I missed it, you already talked about it. And the second question for Tawfiq Saab from PND-KP. Talking about sustainability, sir, you mentioned concept note scrutinization, and then there is committee, it becomes part of ADP. It's a standard process throughout the country, in every province, in every department. Talking about sustainability, is it becoming that becoming part of ADP a sustainability issue addressed? Again, slightly differ with you. That's not the case. We're just increasing liability. The only way we can make it sustainable is when we make it conditional cash transfer. There was some discussion in the earlier sessions where we are able to create livelihoods, where we are able to make that social protection into a revenue generating livelihoods protection, livelihoods generation scheme. But if it's only conditional cash transfers embedded into annual development program, sorry to disagree with you, that's not sustainability, sir. Your remarks.
So we start off with Aisha's question about to what extent are district level inputs taken into consideration when developing certain programs, and then we go over to the next set of questions with Dr. Nadeem Saab and then Mr. Tawfiq. So who has some input on the district level input question?
Thank you, Ms. Aisha. It's an excellent question, and unfortunately districts do not have a direct say, at least so far as the district administration, I would say, in the human capital development or the social protection as such. When COVID struck back in 2020 early, I was a deputy commissioner in one of the districts, and frankly, it was the first time I have ever heard the name of NSCR. I did not know it existed. We knew about BISP as civil servants, but the entire science behind and the entire framework of the NSCR, I was first introduced to it as a deputy commissioner, but even that exposure was very superficial, in the sense that we knew that there was this database from which people can apply to, but it was only after stepping into the social protection domain that I realized that the whole targeting is a full-fledged domain. However, I think that is changing, especially with the advent of, I think one of the reasons why that is because the NSCR and the BISP are a federal entity, are federal entities. And since they did not have they did have presence at the district level or at the field level, and even their offices, but they did not have a direct administrative linkage with the district administration and the provincial administration. And so everything that, even when the provincial governments were hinging upon or planning their social protection initiatives based on the NSCR, what was happening was that all that data was first going up to the top at the federal level in NSCR, and then from there coming to the provinces and then trickling down to the districts. So districts as such did not have any direct role. But now with the advent of PSCR, and this is not that something that I had thought of earlier, but your question has sort of provoked this thought in my mind, that now, because we had a certain target for every district for the registration of Ramzan related Ramzan Nigeban package, so all the DCs are now fully familiar with what PSCR is, they don't know what goes into the PMT formula, but they know that there is a PMT thing. They know that there are disqualifications, what are the wealth filters. So I think, we can debate about it from both angles, but the very fact that there is a provincial socio-economic registry now, and the district administrations are now involved in it, has made this notion and this concept, the DCs have been, the deputy commissioners have now been exposed to it, And since I've been in touch with all the deputy commissioners of the province while we were undergoing this Ramzan drive. And many of the DCs have now started to think creatively about using this data. And it has also not just enabled them, given them this data framework to plan about their human capital investments within their districts, but it has also sort of made them think about in data terms. And it has also it has also introduced them to the gaps that exist in their district. For example, one district may be lacking in, one thing and the other may be lacking in another. And the socioeconomic registry and the analysis performed on that is helping them get familiarized. And I think it's a welcome step. And although it did not exist in the past, but I think 5 years, 10 years down the lane with the advent and presence of socioeconomic registries at the provincial level, I think the district level planning would also be based on that, and maybe in future even more granular level planning will be based on these initiatives.
Thank you. I think that's quite interesting as well. And when we talk, one of the words that was spoken earlier, which I wanted to come back to, was also integrated social protection. And I think this is also going to open up avenues, perhaps for even district social welfare offices to tap into that resource and to maybe have better expanded programs and all that.
Sorry, just to come in quickly, that yes, under the PSCR, we have made district social protection committees, which are headed by the deputy commissioners. The social, they're currently called the district PSCR committees, but we're in the process of renaming them as district social protection committees. And they would have representation from education, health, and all the relevant departments, planning and development department, and the deputy commissioner would be the head, and the district police officer would be represented there as well. So the trickling down is underway, and I think in due time things will improve at that level.
Excellent. So that's more of the diagonal coordination I was talking about earlier, and that's very good to hear. So Dr. Nadeem Saab.
Thank you very much. Regarding the question about public-private partnership, as we all know that the private sector has got the corporate social responsibility inbuilt into their own system of management and operations on day-to-day basis. The idea is to take, without private sector's collaboration, we have seen that nowadays it is very important to take them along on the board to serve this purpose. And for that, there can be a scheme which can be introduced to give a kind of tax incentives. The private sector can be incentivized with some kind of tax rebates or remissions if they collaborate with both the federal government as well as the provincial government to take it as their corporate social responsibility and support the provincial government and the federal government in this regard. Secondly, the provincial government, which has to take this ownership of these social security programs, the provincial governments can identify the high income generating private sector groups, and those private sector groups can be taken on board for some kind of a small social protection levy, or again some kind of benefits at the local level, so that they can be incentivized and they come forward to support the provincial setups at the provincial level as well as the district level, as my respected colleague has pointed out. So that in this way they can reach to the grassroots level. So that can be a way forward to take them on board and get the desired results. Thank you.
Thank you, sir. And then finally, Tawfiq Saab.
Thank you very much for making point of disagreement. Actually, there are procedures, I think, all over the country, but it is to ascertain that how much these are enforced in letter and spirit. That I wanted to make the point. Thank you.
Thank you so much. So unfortunately, we are out of time for questions, but I would invite everyone to continue with these discussions once we close. And just as another food for thought as we close the session, as nice as it sounds, we need to think, whether or not we're in a position, or will we be in a position soon, to enable social protection to be less palliative and more preventive, because that happens to be one of the ultimate goals when we're talking about ex-ante measures and even adaptive social protection. And can we work towards, at some point, or do we see a future where we can eliminate the causes of said vulnerabilities that we talked about earlier? So I would like to wrap up by extending huge thanks to all of our panelists, and thank you for being very responsive in the lead up to this panel as well, and for your inputs. I see a few more hands raised, so turns out my eyesight is not as bad as I thought. But since we are short on time, maybe we can continue with these discussions. And we have our documentation table. I see that it is more populated over there on their pin board as well, potentially. So do share your comments and thoughts over there, and our panelists will be around, I think, in the coming days as well, so we can continue these discussions. Over to you, Jost. So I think we can thank you.
Please join me in a hand to all panelists and our moderator. You saw in the agenda that we have so-called reflection time. I dedicated all the time to the panel, so I will not request you now to go over time. However, tomorrow we have 2 people who are going to be our reflection ambassadors. We're going to look for 2 more for day 3. And and I would like to take our colleague up on the suggestion that you can ask all these questions you have buzzing in your head to respective people over dinner maybe. And the dinner is going to happen from 8 to 10 at the CBR room. That's correct? CBR room is where? That's here. So we're gonna clean up a little bit, so take your belongings with you, and then from 8 to 10 you can eat here and sample more Pakistani/Karachi food, I suppose. And we're going to meet tomorrow at what time? What's the program say? 9 or 9:30? 9. That means 9 o'clock, right? 9 means 9? Okay, so please be on time tomorrow, that we can actually start on time and finish on time as promised. Okay? So I need someone to help me to finish the gong. And there was a colleague who was practicing. Can you come here and finish the day? He was really happy with the gong. He actually tried to help me during the break that everybody comes back on time. Mr. Zahib from NDMA. So this finished day 1. See you tomorrow at 9 or at dinner. Maybe I go out of the safety zone. And, okay, he's too quick. Okay, that was the end of day 1.